Dr. Lindsay Renzullo. Welcoming you back to the podcast. We also have on the call
Dr.
Dr.
Christopher Nalikin.
So we're so happy to have you guys back here today. Again, we're airing from home, which is sort of a cool new thing in the COVID era. But we thought we would sort of talk to you guys about being at home and being with our animals, and maybe some things that are normal with our pets. We're getting a lot of people that are home that are with their pets a lot more than they normally have been for in the past. And what that's sort of bringing to light is a lot of people noticing things about their pets that maybe they hadn't noticed before because they weren't home with them all day. And they're getting concerned about whether or not this is normal or if this is something they should be concerned about, and bringing them in for an appointment to have them be seen for things that is just sort of normal for their dog or their cat. They just happen to be home and watching them all day.
Yeah, so I mean, truthfully, like we're always happy to see these pets, but like we do feel bad sometimes. First of all, charging an office visit for something that's normal. Um, and also, you left your house out of quarantine to come in for something that was completely normal, but you didn't know, and we didn't know until we saw you. So we're going to just kind of do a little potpourri of things that we've had recently seen, or things that we get even before this whole thing started, where clients will come to us and be like, I noticed this. And we're like, yep, completely normal. Yay. Which we all like to hear. So I was thinking, Lindsay, we could kind of start a little nose to tail, and we'll veer, I'm sure, in our true fashion. Um,
Definitely
but
will be.
I get a lot of questions about like what's normal with eyes.
Yeah.
Um, so, my first thing that I always say to people with eyes is it symmetric, right? Because a lot of normal eye things, they happen in both eyes, discharge,
Mhm.
that kind of thing. And abnormal things will be just like one eye, right? So, what do you think with eye discharge? Like, what do you tell people with those eye boogies? What's
Yeah.
normal and what's not normal?
Well, it is funny because I mean, we sort of have that layman's term of like eye boogies, like for
Oh,
that
I
morning
use that all the time.
sleepies. Yeah. And so, I mean, you think about yourself, like even humans, I mean, there can be some mornings you wake up and maybe you don't have anything sort of in the corners of your eyes. But other mornings you do. And if you had somebody that was sort of sitting there looking at you, and every morning you woke up, looked to see if you had eye boogies and got worried about you and brought you into the doctor, then that sort of, it would be sort of funny, right? Because you would get them, sometimes you have them more than others. At least that's what happens with me. Like I don't always have eye boogies in the morning, but
Right. I,
sometimes,
I get like more discharge sometimes because I have little mild allergies and it just
yeah,
hits my eyes. They get itchy. So this time of year, I wake up with little sleepers and not, in the middle of the winter.
yeah. So I think it is sort of realizing that during this time, pets, just like humans, we do have things like allergies, mild inflammation, things like that, whether it be environmental. Right now, we've got a lot of pollens and things out there right now. So they can get very similar stuff. And so you'd think it would be a concern if that discharge really lasted or persisted throughout the day. It was also in conjunction with them squinting. Squinting is the hallmark sign that that pet is uncomfortable. And so, if you have any animal that's squinting their eyes, that definitely can indicate that maybe there is something a little bit more than just a very benign, sleepies or some discharge that they're
Or like
getting.
that pawing, like that classic, like, oh,
Yeah.
pawing, or even taking their whole head, right, and rubbing it on the floor. Those are usually signs of itchy eyes.
Yeah.
One thing I will say I've noticed is that, so my dog, who you all have met a few times, Lucy, she won't let me pick out those boogies. So basically, I go between grooming appointments, and I usually know that it's time for grooming. I'll get the confirmation call like the day after I notice that she's got, more boogies in her eye. So I think a lot of us have taken for granted that our groomers just clean those out.
Yeah.
And now that our pets are going a little longer in between groomings, you see these black, they look terrible, these like
Yeah.
big black things that you never saw before because your groomer just was managing it on a regular basis. So I would say, like, for me, that black or reddish sort of eye discharge is pretty normal, especially in the terrier kind of dogs with a lot of
Yes.
hair around the eyes. And like yellow green discharge, especially just happening on one side, it would be less normal. And for sure, the squinting that Lindsay mentioned.
Yeah, and I mean, to the point of those black goobies, I know with Lola, my little Yorkie, if she gets enough of them, and I'm sure other people can attest to this too. And again, grooming departments are closed right now. But if you get enough of them, sometimes they can sit so close to
Yeah,
the skin that they can cause redness and irritation. So if your dog will let you, taking a warm washcloth, kind of putting it to that area, it will soften that discharge there just a bit and allow you to kind of clean that
just pick it
area.
out. It's so
And
satisfying for
oh, it is.
pickers. Yeah.
And it smells all funny and
Ugh,
stuff when you get it out,
yeah.
it stink, but yeah,
Yeah.
it's lovely. It really is lovely to move it.
And then other with the eyes too. So one thing that I tell a lot of owners is that if you have their corneas, their clear part of their eye should be completely clear, right? And if there's anything that is not making it clear, that should be a red flag for you to bring them in. But there is a big difference between the cornea, the outer layer being not clear, and what's going on inside. So a lot of older dogs, they get what owners describe as cataracts. They're not cataracts, but there's an old age change that happens with dogs. Not so much with cats, I
Yeah.
guess, but with dogs, when they're like 7 or 8, usually that owners will see. The big difference there is that that's happening in the lens, which is behind the iris. So if you look at your dog's eyes and you can see the entire iris, usually in dogs it's black brown, sorry, and in cats it's like green or yellow. If you can see that entire structure, then you know that what's happening is usually behind it, right?
Yeah, that's a great way to put it. Yeah, it really is. Good description.
Anything
Um,
else with eyes?
oh, I could talk about
I
ophthalmology
know.
all day
That's why I
long.
started with eyes.
But we won't. I enjoy ophthalmology a lot, but we won't go anywhere. I think that's sort of the most common thing. Yes, see squinting, color change, eye looks bigger, anything like that. I mean, obviously, we always want to err on the side of caution anyway. But yeah, those little sleepy, those little discharges that you can see, those are probably the most common thing why people come in, and it really is nothing to be worried about. Moving on to like the ears, I do have a fair amount of people that will start saying, "Oh, I think my pet is scratching." Maybe they're shaking their head. Is this an ear infection? And scratching can be not only just the ears, but just sort of the whole body in general. And that's a great thing too, because I feel like we're with our pets now throughout the whole day and evening and forever. And so we're watching them a lot more. And so we're seeing them kind of do scratches and stuff. That's a lot of it can just be normal. I mean, the big thing is if they're scratching to the point where they're causing damage to their skin, or throughout the whole day, they're spending a significant time sort of scratching or itching at themselves, that can definitely be a big flag that something else is going on inside their ears. If there's an odor, or if you look inside the flap and you see any like brown discharge, especially like a deep dark brown discharge, or any kind of inflammation, the dog cries when you're looking in the ear because it's really inflamed around that. I mean, those are signs of an ear infection. But just sort of scratching the ears, they might scratch them a couple of times throughout the day, kind of just as they're grooming themselves, as they're moving around. Same thing goes with us. I mean, we're kind of touching ourselves all the time and moving around. And if we had
Don't
somebody
touch your
watching,
face.
don't touch
Yeah,
your
you're
face
home.
right
I
now.
know you're home.
Yeah. If they're touching your face, or you're fiddling with yourself, if you had somebody constantly, watching you and pointing it out, then then you might have somebody bothering you a lot more than you need it to be done. All right, let's think about like breathing patterns and things like
Sure.
that. Probably the big thing I get, and I've had before, and I've had actually owners videotape it for me. And there is a potential if there's something to be concerned, but breathing patterns, one of my owners was panicked that her dog was having an increased respiratory rate. And, obviously, we talked a lot about it. We had the dog come in, we looked at the dog. Again, we listened to the heart, the lungs, everything seemed great. The dog was young. She said, it's not always the same time. Let me videotape it for you. Perfect. Videotape it for me. And she would only videotape times that he was asleep. And dogs, just like people, can have, active REM times in their sleep patterns. And he was dreaming and his muscles were
Oh,
twitching and he would breathe really fast. Sometimes he would
yeah.
even do a bark. I said, that is the only time you're seeing this? She said, yes. I said, this is totally normal. That increased breathing is him just having a really cool dream. Maybe he's chasing like a rabbit or something and having a great time. But that can look scary if you don't know that dogs can dream as well, because they can be quite. They think they might have a seizure. I've had people think that they've been having a seizure before, and it's not.
Yeah. Yeah, and I mean, reverse sneezing is another thing that sounds
Yeah.
very scary. We've talked about it before, and I think we've done our little descriptions of it. But that's, you can Google dog reverse sneezing and find a million YouTube videos of dogs reverse sneezing. It
I
sounds
have
super
a good
scary.
impression. I have a
You
good
do?
impression.
Go ahead. Go ahead.
Yeah, okay.
Go for it.
It's like this.
Yeah. Uh-huh. Every time I do it for owners, I sneeze. So yeah, like that is completely normal. I've had people rush their dog in through emergency because they've
Yeah,
never seen it before. And it is a normal thing. Now, it can be abnormal if it suddenly starts, right? A dog has never done it before
right.
in their entire life. And then all of a sudden, at the age of 12, they start doing this 15 times a day.
Yeah,
They may have like something stuck back there, a tumor or something. They can do it because they have a foreign body in their nose, like a
yeah,
piece of grass or Easter grass or
yeah,
um, anything. But
yeah,
usually it's something that'll just randomly happen. My dog does it when she eats too fast. I think we've talked about that before. Or when she gets like super excited on a walk. They look like they can't breathe, but they
yeah,
they can get enough oxygen. They're not suffering. They're just having a little sneezing fit. It's just that it sounds way more crazy than any other sneezing fit you've ever seen.
yeah, definitely. Yeah, and I definitely encourage people to Google it in case my impression
Oh, your
wasn't
impression is spot on. I do get calls from owners who say like they're panting more. So panting's tricky because there are times when panting is a sign of something abnormal. It's just not usually a sign of an actual respiratory problem. So panting is a mechanism for dogs to breathe off a lot of their excess heat because they can't sweat. So it is a major way that they cool down. So right now it's getting warmer outside. So yeah, dogs are going to be panting more. You probably don't have your AC on yet because the temperature doesn't dictate that, but they are feeling that change in the temperature and they have to adapt to it just like we do. So it can also be a sign of anxiety. It can be a sign of pain. It can be some endocrine diseases. Cushing's disease, for example, will cause them to pant a lot more. So it can be a sign of problems, but it's usually not, right?
yeah,
And it's
so some
very
of these
vague.
big non-specific clinical signs, that's a classic term what we use when we say, look, this is a sign. We're not acknowledging that it's not an issue, but you have to look at it in as a whole with a bunch of other factors involved. So are they panting a lot and also walking around and can't lay down and can't settle themselves? Then that's going to be a little bit more of an issue. Or are they just sitting there relaxing, like on the floor, just panting and look nice and calm and just sort of getting off that heat and just doing a normal dog thing.
Mhm.
So looking at it in conjunction with other clinical signs that they may be having at home is important. Yeah, so we can get, right now it's getting warmer, right? So we are getting more ticks on our patients that, people feel sometimes they think they're like a mole or, a little growth. And when they look down, they actually can see they're a tick. They see the little legs. And people have the range. Some people are really comfortable with ticks at this point and know, they follow the CDC guidelines and the guidelines that we go by as well, where you basically take tweezers. There's even like these little special tools you can buy, which I think are overpriced, but they're like tick removers where you can grab it at the base, right at that head, just do slow, steady pressure and pull the tick off. But some people like freak out. They get all nervous about these ticks. They get nervous that if they do try to remove a tick, they think that they're seeing like a piece of the mouthpiece that's still left behind and they get really panicked. If you try to remove a tick at home, which I think is totally safe to do, the CDC actually has really good pictures on how to remove ticks. It works for humans too as well, so it's good to kind of go on there. If you're a picture person, you can see they recommend gloves and doing the tweezers and all that stuff, slow steady pressure. If you do leave behind a little mouthpiece or things like that, it actually isn't anything of concern and nothing that we would actually do anything about anyway. The body has a great way of kind of pushing that mouthpiece out, they'll form a little scab over it and just kind of spit it out. So you won't need to come into the hospital for something like that. We would just sort of say for you to watch it at home, and it might look red or inflamed as that mouthpiece is getting spit out, but it's okay.
Yeah, and often too, I'll get people coming in with like a little crusty area, right, where I know there was a tick there and
Mhm.
they didn't see the tick.
Yeah,
But if you just have like a single little tiny crusty spot, and especially in like the head, neck, behind the ears area, that's what that usually was. They're nothing to worry about. So if your dog has just like a little scabby area, usually those would be things that I would say, just, you know what, keep an eye on it for a little bit, a couple of days, send me a picture,
Yeah.
whatever.
Yeah.
um,
And our producer actually mentioned that her dog got bit by a black fly earlier. So black fly bites are these little tiny things that can bite. They're very small little guys, but when they bite, they sort of leave by like this red ring. The bite looks like a little red ring. And people often confuse it or they get worried that it's sort of that bullseye, from a tick bite or ringworm or other types of things. And a lot of those are just really benign. The hallmark is normally when they get bit by it, they get bit by a lot of them. So all of a sudden they look at the belly and there's a bunch of these things on their belly. And that's the most common spot where people will actually notice it just because there's not a lot of fur down there. And so there's more of that naked belly look.
well,
And
and they like to lay on their backs and roll around in the yard, right?
yes, yeah, that's true. That's true too. Um,
What else? Toenails. We
yeah,
so many calls right now about, can you cut my dog's nails? And
yeah,
cats. Cats, every appointment I see right now,
they
I have
want.
to trim their nails, which, you know what? Fine. It's fine.
Yeah, nail trims are tough because I mean, in theory, it's not a medical emergency for the most part. You can get a few patients, and often it's older patients that don't
Cats
really do a very
especially.
yeah, they don't really do a good job grooming themselves, and their claws can kind of overgrow and like almost curl around like a Guinness Book of World Records look and go into their carpal pad, and so that obviously needs to see a vet. I mean, a lot of times those can get like mildly infected too as well. So we definitely want to see them and help your kitties out. But we encourage people to try to nail trim at home. I mean, a lot of us are now painting our own nails at home and doing our own hair at home, which is awful. But yeah, I mean, we have a great video. I think is it on our archives, like where they would actually
On
access
YouTube. YouTube.
it's on
Yeah.
YouTube
Yeah.
of us showing you how to trim your pet's nails at home. We're not, we're not silly. We know that some of our pets just absolutely hate getting the nail trims at home. Like, so we know that they're not always easy patients for you guys. And that's why a lot of times you want the vets to do it. But we do have, if you have a pet that's amenable to having its paws touched and its claws sort of touched by you, and you want to try to give it a go to trim your pet's nails, you could definitely go onto YouTube and check out the video and give it a go.
And it's a really great time too to, you do have, many people have a little extra time around. So, take it easy, take it slow, put some peanut butter on your forehead. Um, I saw a video of that, right?
There is a video of that going
There was a
around.
video of a lady putting a whole lot of peanut butter on her forehead to get her
Yeah.
dog distracted, but that actually does work. And if you don't make it a negative thing, so like really bringing your dog or cat into the vet to trim its nails is fairly traumatic. So I don't want to say that anything we do is traumatic, but like if they really don't like their nails done, then you add that extra, bring it into a place where they're not always hugely positive. We try our absolute best. We're actually working with the Fear Free program to try to improve all of that too. But like, it's better at home if you can do it. Of course, we don't want you to get bitten or anything like that.
Yeah.
But like, too, people don't know how long their animals can go in between nail trims, and every animal is different. But like,
Mhm.
these generally, like, we've been on effectively quarantine now for what, 7 to 12 weeks, depending on where you are. That's a reasonable interval between nail trims, right? So nobody is really in an emergent state unless they're one of those cats that's nails are growing around. So, just because your dog's nails are clicking on the floor doesn't necessarily mean it's an emergency. You could try it at home, give it a shot, especially
Yeah.
if you're in an area where like you can't get to a groomer or your vet or whatever, and your vet won't do it.
And there is sort of the world's natural Dremel, which is the pavement. So the
Yep.
roads and stuff, they work great. I mean, if you walk your dog on pavement, that natural action of them gripping every time they're walking kind of is a natural Dremel to those claws and kind of can take off a few millimeters, even more, and really help you out, kind of extend your nail trimming time.
Now, of course, that won't work for cats, but yeah.
Oh my God. No, not for sure. All right, what else? Let's
Well,
think. These are good
scooting
topics so far.
and
Ooh,
scooting.
scooting is a great
Scooting.
topic.
So, scooting is usually itchy butt, right? They often get an itchy butt when their anal sacs are full. And, this is a weird thing. Anal sacs, dogs and cats have them. I'm told people have them, although I don't think the doctor that I was talking to recognized what we're talking about in dogs.
We do. I
Um,
don't. Yeah, that's crazy.
so this is a scent gland, right? And every time they poop out a little bit of this yucky scent that is their unique scent, right? And it's why sort of like cats in the wild smell each other's poop because that's their unique scent.
Yeah.
They seem to have issues with expressing those. Some animals just have issues. They don't properly express them and they kind of fill up and irritate them. Some animals it's after a bout of diarrhea because maybe the hard poop wasn't allowing the anal sacs to express properly. And some dogs and cats, I've seen actually a fair number of both that get infections in those
Yep.
areas. Generally, scooting is just not necessarily a sign that they immediately need to have their anal glands expressed, but if they're repeatedly doing it all the time,
Yeah.
then usually suggest it.
Yeah.
How do you feel? Does your dog ever just run around and like just
Oh, she does.
randomly? Yeah.
Yeah, she does. I mean, and it's distinguishing whether or not it's like anal pruritus, which is like itchiness on the bum, and is it secondary to anal glands or is it secondary to allergies? Because some dogs can have allergies and make their bum just itch. And their anal glands can be an issue. I mean, I'm sure some owners that are listening right now have had or heard something called like an anal gland abscess, where the anal glands, because those two glands can't express normally and they get infected, they can rupture. And that's obviously something that you want to bring their dog in for. The way you would know it would rupture is it's very painful. A lot of times you see bleeding from the side of the anus, not the anus itself, but just right to the side of it where that anal gland is basically popped open. Um, dogs you get a fair number of dogs that can just kind of do a little scoot or a little itch in their butt, and it's okay in the grand scheme. Again, talking about how often are they doing it? Are there any other signs, attributed to it? Do you see swelling back there? Do you see blood, any abnormal discharge? But yeah, for the most part, just sort of anal scooting every now and then is not anything that we have to get super worried about. Sometimes they get like a piece of poop stuck to their bum and it feels funny and then they just scoot it off. So just looking for it in conjunction with a bunch of other signs or how severe it may be is important. Exactly. Normally, you shouldn't need to. I tell the majority of people, you shouldn't have to express your dog's anal gland. It's if they're giving us signs that there is some sort of issue behind there. So it would not be on a routine maintenance thing by any
Right.
means. Yeah, that
Right.
was a good one. I like that one. Yeah.
Anything else that you can think of? I can't think of
Well, let's
anything.
save the best for last. I mean, some of
Oh
these
yeah.
we'll save the best for last. So I recently got, I mean, we were talking about all these pandemic puppies and kittens and things like that that we're getting. And some owner came in recently and was super excited because she had this brand new baby girl kitten and she had it named something very, very feminine. And I won't say it because I don't want to out the owner, but I think she thought it was funny as well. It was a very feminine name, like something like Princess. And she was so excited. She had this little baby girl and she'd already gotten it some clothes and like this jewelry necklace that was just like gorgeous. And so she comes in to see me and I do my full physical. And as I'm doing my exam, I said, "Oh, well, Princess here, has a penis actually." And Princess is actually
Well, you don't know what princess's pronouns are.
yeah, well, this is true. I don't know
It's true.
how she relates.
Right.
However, I said, "Well, she has a penis. This is actually a boy." And she said, "There is no way." She goes, "She has nipples." And I said, "So the she has nipples." We've had owners very often because they see their pet having, the nipples. They'll have, chains of them. They'll have their cranial, caudal, different types of mammary glands. They'll normally have a set of 6 or 8. Um, they think that it was a girl, and I just say, just like you know, our human counterparts, males also have nipples, and it doesn't mean that they're necessarily female. So she was
Yeah.
quite surprised by that. It was very funny. It took a while for her to really process that that she was going to have to rename her little princess.
I think it's the most fun thing because I've had multiple, like I have this one, couple who always comes in together and they're just adorable. And you've had that awkward, but not awkward because I know them really well. I'd be like, does he have nipples? And she'd like look at him like, yeah, he does. He does have nipples. Like, well, so does this boy cat. So
Two of our male colleagues, they've had those similar conversations with owners, and it's
no,
very
no,
funny.
I
They say
bet.
they say, "Well, actually, I do have nipples myself." So our male colleagues, it's very funny for them
Now,
as
I
well.
will do not think that it's a tick and rip it off.
Yeah.
So happens with both girls and boys actually, where the owners, feeling around and they're like, "Oh my
Right.
god, she has a tick," and they rip a nipple off.
I
Like,
know.
oof,
Because
woo,
sometimes those nipples, especially as the dogs or cats get older, they can sometimes dry out a little bit and they can feel instead of, soft like they used to before, they can have a little bit of a scabby feel to it and they'll just grab it and pull.
yeah, woo,
That's not well received by the pet by any
no.
means. No. Yeah,
So I think our last topic was going to be just like a little brief segment about online pet pharmacies. I think we've talked about these before a little briefly, but especially with everyone kind of trying to stay home, I know a lot of people are choosing to order their meds online. It's really convenient. I actually ordered food online so I could avoid going to the pet store. So we are, seeing. I think we always see a lot of online pet pharmacy requests, but certainly I think more now.
definitely.
And it's a weird thing. We were talking about this earlier that like in the veterinary industry, especially compared to other industries, like we're competitors in a way with these pet pharmacies, but we're also our cooperation is required too, right? So you can't
Yes.
get your heartworm pills unless we sign off on it and write a prescription. Maybe it's similar to, I guess, optometrists where they sell the contacts or the glasses
Yeah.
there, but also um, you know are
We can get
competing
it
with online
places.
pharmacies.
Yeah.
So I mean, it is certainly, we cooperate fully with all the online pharmacies and write those prescriptions. Um, but there's a lot of, I think, misconceptions about pricing. Um, and even we get a lot of negative complaints. Why are you more expensive than the online pharmacies? I mean, it's the same thing as why a brick and mortar store might be more expensive than Amazon for an item,
Yeah.
right? So I
That's a
don't know.
great
Do you want to
example.
think of that?
Yeah, that's a great example. I mean, as a vet hospital, you can only stock so much inventory. So we don't have an unlimited warehouse to stock all these medications. So ordering wise, we can't order the same bulk volume that a lot of these other places can order, nor do we have a place to stock it all. And we can't order every single item. We have select items that sort of as a veterinary team, we've decided are the ones that we think are the best ones right now, or the ones that we really would back, for our clients. Um, and so price wise, we just can't compete. I mean, there's not a fair comparison to sort of stock a smaller volume at a hospital with the veterinarians and the staff that we employ comparison to some of these big pharmacies with these big warehouses. We can't compete with the price with those medications that they have. So yes, you can get things a little bit cheaper online. We will never not write a script out for you to get medications elsewhere. But right now, understand that the medications that we sell in house, we're not making like a significant profit off of those medications. The medications themselves are expensive anyway. There is a small markup as well, but it's not something that we are making a substantial amount of money on, or it's contributing to a huge portion of our hospital revenue.
Yeah. Yeah, I mean, when you think about so some of these larger pet pharmacies, you really can't compare what an online pharmacy who does not have to maintain a large, expensive hospital in Massachusetts, Chicago,
Right.
California, I'm just giving examples here, but like some of these pharmacies, they're located in lower cost real estate areas with a lower cost workforce.
It absolutely is. And I mean, for all of our clients, buying it from a pet store or buying it from a veterinary hospital, you can be assured, and not that I'm not going to say that any of these online pharmacies storage or any of these handling of the medication is inappropriate. I'm not going to speak on that, but I can at least speak on our end that we know that we're storing this medication appropriately. It's being bought by reputable sources, and I feel very comfortable giving medication from our hospital.
Yeah. Yeah, so I mean, in the end, it's your choice, and I seek out the lowest price for many things. So I'm not suggesting that you should always buy it at your vet, but I do kind of ask for, I think, some patience in the the pricing and understanding that the prices are what the prices are for a reason. They're not gouging. We're not gouging. Hospitals are charging what they need to charge in order to keep those doors open and keep all of that highly trained staff helping you.
Yeah.
Um, and then, on the prescription patient side, I, I think that everyone needs to recognize that all pet pharmacies do not um, manage their relationships with veterinarians well. So some of
Yeah.
them do, and
Yep.
some of them are really tough in that they'll send us a prescription request. We will send back the prescription, and then we'll get another prescription request the next day. And they will be telling their clients that vet did not respond. So that is one of those sticks in your craw kind of situations
Yeah.
because we know you're being told by the pharmacy that we're not doing our job. And it's really the pharmacy that's not keeping up
Yeah.
their end of the bargain. So, we have several pharmacies that we have online portals for. We have several pharmacies we have to email scripts to, fax them, and we get over 100 prescription requests a day at our hospital. So, I can say that that's very likely the case at most hospitals.
Yes.
So, we need you to understand too that like we're trying our best, I think, in all of these situations. And sometimes the pharmacies are being very forthright with you, and sometimes they are kind of covering their own butts and not
Yeah.
like being fully honest about the issues.
Yeah, definitely.
So, so any other things to add about pet pharmacies?
Geez, no, no, I think that's good. I think that's pretty much sums it up. Yeah, I don't really have anything else on that topic. I love the topics, the normal stuff, and reminder that we do love seeing you guys no matter what. We're starting to implement at our location and a few other locations as well, telemedicine appointments too, which are really awesome. So if you do have a question where you are a little bit hesitant on whether or not it is normal, but you have maybe some pictures or some videos or something like that that you want a vet to take a look at, now's the time. I mean, it's a great way where you don't have to leave the home, and especially where these are not necessarily urgent issues where you're like looking at your dog going, oh my gosh, I'm like really worried about this right now. This is a crisis. You want to be able to have a vet sort of touch base. Telemedicine is an awesome way to get in touch with us.
Yep. All right. Well, thank you for joining us on the podcast today. I'm Christopher Nolikin.
I'm Lindsay Manzula. We hope to see you next time. Thanks so much as well to our sponsors, Ethos Veterinary Health. And don't forget to look on iTunes and Google Play and all the places where our podcast is airing.
And rate and review us.
Sounds good.
Thank you
See you
very
guys next
much.
time.